damage that it can do and the massive effects that it has. So right away, got my amalgams out properly, done properly, probably tried to search that out. But I did have that crown, and did years of detox. Getting better all along, but still having my issues. And I had one crown. And I was put in by a friend of mine who said, no, there's no mercury under there. We didn't put any mercury under there, there's nothing there. So I waited years to get that out. I trusted her.
But he now would have a hard time detoxing.
Hard time detoxing, very reactive, very inflammatory, couldn't get into ketosis very well, just thought it was
another sign.
Taking time, right? Maybe I just have so much, which I knew I had a lot of mercury, until December, just this last December. I'm like, okay, I'll finally get this last crown replaced, right? It's old, it needs to be replaced. And our dentist now is a good friend of mine too, and she's been on me, there's gotta be mercury under there. I was like, no, it's okay. I asked, there's no mercury. She takes it off, and I'm in the chair, and I remember this because, boom, they popped it off, and she punches me in the shoulder. She's like, damn it, no. Oh, sorry. Turn out, there's massive amalgam under there. Huge. So much so that they had to remove so much of the tooth that they didn't know if they could put a crown back on it, right? But I can tell you this, and we hear this from people all the time. As soon as she took that off, that was the clearest week I've had mentally in a very, very long time.
Well, now since that happened, I've watched you physically change.
And that's awesome. It's a massive compliment to me because that's been part of my struggle, right? As a healthcare individual practitioner, very conscious of how I look and what I deal with, right? That's part of my struggle. And that's kind of the running joke, is if you've ever met me before or heard us up here before, a lot of this is new. Because we talk about the effects of mercury, right? And the hormones and the detox and the cellular connection. I've never been able to grow a beard, ever, right? And I went to Mexico in February, and this grew back within a week, right? I was going bald, fairly thin hair. Now my hair's growing back, right? We'll talk a little bit more about a story. There's a massive thing that half the time we have, but I mean, this is the stuff that we've been doing this for years, and that's my story.
Yeah, and we, listen, I had a gal work for me for years, and she too had trouble detoxing, right? I mean, everything was hard for her, even though she was so disciplined. One day her crown pops off, and her dentist said there's nothing under. Of course, there was amalgam under it. She gets it removed, her world opened up. Hers was just a small little piece. That's what we're dealing with. So one thing that we're really good at is digging upstream at these causes. Now, I'm not going to spend a lot of time here because I want to get to the third one. But mold is another big one. I mean, how often do we have, patients and clients that they're not getting well, you have mold in your house. Of course, nobody sees mold, right? Of course. And then finally, the test comes. And it just happened. Matter of fact, I had a conversation with my platinums last night at the platinum dinner that happened to a patient that we actually had in common, that she went to her house and said, what's that black, right? And she actually saw it. She's like, oh, no, it's fine. As it turned out, we tested it out, so it wasn't fine. But the bottom line is, her kids were affected, she was affected, and her husband was affected. It happens all the time.
All the time.
All the time, yeah. So, again, we do a lot of teaching on mold, how to find it in your home. It's always hidden. We're getting even better at testing it in the body. The VCS test is always the first line, because when people fail rows C and D massively, there's no doubt a biotoxic exposure. But there's getting some better urine testing that we're working with right now. We used to run a test out of National Jewish Laboratories, or actually LabCorp did it, called C4A little a, C4 little a test. But now LabCorp does their own C4A, and you can't use that. So you have to have an account with National Jewish. But now the urine tests are getting better. But mold, again, it's one of these things, it's when you look biblically, Leviticus 14 actually talks about the evil of mold. I'm telling you, it ruins lives. When you read that, you realize that, this is something not normal. This isn't, the average toxin that makes somebody sick. No, mold devastates people's lives. Oh, and by the way, even when you get out of the exposure, it creates a sensitivity and an upregulation of the nerve system that's horrific. And we have to downregulate that, retrain the nerve system, that everything's okay. It's a horrible thing. And by the way, again, when you showed me, I drew the cell and how that, the toxin makes its way to the liver. That binding complex, binding that biotoxin away from that biocomplex is a big part of our protocol. We give that not just at night for these types of patients, but we give it throughout the day. And that is a critical component to helping these people. But here's what we want to talk more about. The greatest hidden danger of all are these hidden infections via cavitations and root canals. You're going to hear Dr. Curatola, who works closely with what we're doing, and we're gathering up other dentists, hopefully, to help us in this mission of getting people to realize that this is where a lot of the hidden stuff comes in. So if you've had a wisdom tooth removed, there's an 88% chance that you have a cavitation. The further forward you go, the less that percentage goes down. So the greatest exposure is the further back you go. The reason is you pull out the tooth and then it heals over, and there is a little bear cave that eventually bears find their way into. We're talking about bad bears. And they end up just crushing your immune system. So much of the autoimmune, the low-grade inflammation, why people can't lose weight, why they don't feel well, their hormones are trash, it's because they have a cavitation. Happened to me, happened to my wife. I had one cavitation done correctly 25 years ago, and it ended up infected. Jerry went in and pulled infection out of a wisdom tooth that was just sideways, and he found a pocket, and he kept going in with the laser, and it just fell in. So I had a wisdom tooth in, partially in, I should say, and massive infection. He takes it out. At this point, I didn't have a cone beam. He takes that tooth, does it correctly. 2 days later, I have swelling and pain, not here, up here. I said, Jerry, you didn't touch anything in the upper left, did you? No, I didn't. Well, what had happened was, I said, I know what happened. I had a wisdom tooth out 25 years ago. Those bacteria communicated with their friends up here. And they were like, we got to survive. And they ran up there. And they went up there. And so I went back. Jerry cleared that. He said, I'm worried about the tooth in front. We don't have time. I can't get to that tooth yet. But I want to see the whole thing. We'll get a cone beam, da-da-da. But the bottom line is, he cleared that one. Guess what these bacteria did? And all these bad guys, some of them were worse than others, right? They communicated to the ones that were just in my gut. I had a sample done. And I knew that there was 4 oral pathogens in my gut. They weren't affecting me. I had no symptoms. But they communicated with these guys, and then all of a sudden I had SIBO show up. Which most SIBO is autoimmune, where it attacks the migrating motor complex. That's the nerves that just move debris, especially at night, through your colon. So a lot of people that are trying to fix their SIBO, it's really autoimmune. Matter of fact, one of the things that happens is food poisoning, and then 2 to 3 months later, the SIBO starts, because it triggers the autoimmune, the food poisoning, but it happens with cavitation as well. It happened to me. So this is, I don't know if you saw the Facebook. I just told you later yesterday, that I was at Jerry's office, and how much that impacted me. This was the case that I told you about, that I sat there literally and cried. I kept turning away because I watched this girl get her life back. The top picture on your left, that's a root canal that was extracted. Massive infection. You should have seen the black and green and all the stuff Jerry pulled out of there. This is a cavitation. So this sucker went this way and that way. Jerry went in with the laser. You can see how he did it. And then the laser you can make go sideways, so he doesn't have to. The old days they would just take out all of this, and it's a long healing process, and it increases the chance of getting another cavitation. The laser produces ozone. The laser is able to get in where you can't get with a scalpel. So anyways, that was her cavitation. This was what he found under a crown. This is a massive. Jerry said the amount of mercury that he pulled from under a crown, galvanism. So there was metal on top of that, which creates a battery effect, which allows the mercury to just vaporize into her brain. This girl had spent thousands and thousands of dollars, still sick, couldn't fix her gut, did everything, went to the best, and nobody looked at this. Not one person. We see it all the time. So I wept because I knew now. And by the way, she was in Jerry's chair because of a patient that I saved her life And she got all this fixed, and I was the only one that looked in her mouth. But the bottom line is, this galvanism that was occurring was putting mercury deep into her tissues. Nobody saw it. Now we have to tell your story, because I want you to talk to that. That was you.
That was me.
That wasn't her, but that was her.
I knew something was off. I didn't have any mercury in my mouth. I've never had a silver filling on any of my adult teeth. But I had really bad compacted wisdom teeth taken out when I was 16. Honestly, anything and everything a dentist should never do to somebody, I've had done to me. And when we found a dentist that did a cone beam and sent it to a radiologist, the radiologist actually stated cavitations. And for the chiropractors in the room who get their x-rays read by radiologists, you guys know how sensitive they are about the words they use. So, long story short, every single site was infected. Ultimately, that infection is gangrene. That's what it is. I was in the chair for 8 hours getting them removed. He had to hold the nerve up to clean out the infection because it migrated so deep. No symptoms, no pain, no nothing in my mouth, but I could not balance my hormones for the life of me. I've done everything. And it wasn't until I got this fixed that I was able to truly remove and address the yeast in my gut. Now my hormones are completely balanced. For the first time since menstruating, I have no symptoms, no PMS, no cramping. It's one of those things where it's like, oh crap, do I have something? Because it just shows up now. But I had to get that addressed.
Yeah.
Well,
Go ahead.
can I say something? Like, and one thing that's interesting, we talk about no symptoms. I like to think that we're fairly good at what we do, and we've been in the functional world, nutritional world for a long time. We used to fight chronic sinus inflammation, irritation. I used to call her my little sniffleupagus.
I couldn't breathe through my nose.
She could
Yeah.
never.
I remember.
Like, always sniffing. The first time she woke up after that surgery,
The next morning,
boom.
Yeah,
I
clear.
could breathe through my nose.
Yeah.
I mean, that's those infections. They're right there by the brain, but they're also by the sinuses.
That's what happened to my wife. This is Marilee's. That hole is her cavitation, and it was affecting her sinus. As a matter of fact, this, if you look at this, this is the cone beam. By the way, you can't see these things on plain film. So, and by the way, many people, oh, I had a cone beam. The dentist doesn't have the software to read it. It's 3D. And so they read it as a plain film and go, oh, I don't see anything. It looks all right. No, you have to make sure you get this read by someone. Jerry will expand on this, so I'm not going to talk more about it. This is my wife. Here's the cavitation. See this? This is where a wisdom tooth was removed years ago. This lucency. And then the infection was going right up. See this centimeter of inflammation? Yeah, it was causing her to snore and like this drainage, and she started getting abnormal cells on that side, and that's what made me have her look. She kept telling me, it was on the right that her wisdom tooth was removed. My wife doesn't know her left and right, so it was on the left. Anyways, this was it, and then we just got this done this weekend. Now look at it. So, and then this is now filled with bone, except there was a little lucency here. So Jerry, we wanted to get another cone beam a year later just to see how it was healing. So he went in here this weekend and just to see what this lucency was. Now there was no infection, thank God, but he refilled this in with PRF. And Jerry's going to talk about that, but it's basically getting some active stem cells in there just to make sure that bear cave doesn't get filled. And by the way, what many dentists are still doing is the old-fashioned method. They're just sticking ozone up in there and going, oh, okay, we killed everything. Oh, it does. But you killed the bears, and then the cave's still there. More bears will find that cave.
Maybe
My wife wants me to tell that story like with Winnie the Pooh, and I just can't get it.
Maybe a little bit, not just a bit like the cave, but I mean everything that bear left in there for its whole time. And I'm not going to go any deeper on that. I think we figured it out, right?
There's a lot of poop.
Yeah.
Well, then it migrates, just like you said. So you get ozone, but it just moves.
Yeah, no, exactly. Look, this is a study from February 2018. I think you asked me for this study. Here it is. 7 out of 10 leading causes of death reported by the CDC can connect with inflammation and microbes in the oral cavity. Heart disease and cancer I highlighted because of today. So we know that cancer is a big deal. So you could just read this slide here. But, I mean, this was a study carried out a 5-year study and concluded 93% of breast cancer sufferers in the study had had a root canal treatment. It also noted that tumors were on the same side. Remember the neurologist last night, he was talking about on the same side? That's what we see. I mean, this isn't, that's Bill Henderson, who, amazing guy. But most common cause of all cancers is root canal and filled teeth and cavitation sites. I mean, we know this connection exists. Jerry's going to talk to you about some more of that in some of these studies that are actually linked to this. Tommy, come on up, because Tommy I did a Facebook Live with. Okay, he showed me this picture last night. You have to understand, Tommy was one of my virtual clients who I helped, and his story's amazing. And when he eloquently did a Facebook Live, I realized I can bring him up on stage. So this guy has been through it all. Now, Tommy is a very successful man, and he had the financial wherewithal to go to the best doctors around. He did, right? You did. 21
Absolutely.
years of pain, liver pain, chronic pain, prostatitis, hormone problems, sexual dysfunction. I can just keep going on. Embarrass him more.
Sometimes I hear a symptom and I'm like, yes, I did have that. Yes, I had so many symptoms, I forgot them. Literally. Maybe I want to forget about them, my experience started when I would say 21, all right? The age of 21, my symptoms started. And now that I know all the information and I played my life back, it basically started after they started playing in my mouth. Amalgams, root canals, so on and so on. So my symptoms started. I would say about a year later, at 22, and I showed him a picture yesterday when I was 22. I started being inflamed. I went from this.
There's the picture. Yeah. So because Tommy was virtual, before he started me, I didn't realize he looked like that, right? Because then I saw him like after he got his life back, and I met him for the first time.
Yes.
And I was like, he shows me that, and he's like, dude, this is where I started.
Yeah, nobody believed me.
I laughed out loud. I was like, dude, I'm so sorry. That doesn't even look like you. I was like, oh my God, really?
So at 22, I started just blowing up. Like, I went from the sexy playboy, literally, from just blowing up.
Oh, by the way, it's George Michael's brother. I'm
Yeah.
just saying that.
Actually,
Yeah.
Jerry yesterday said I look like someone else.
Yeah. I love this song. Anyway, go.
So my symptoms started, and basically, I was young, I didn't pay attention, but I started having severe pain, liver pain, hormonal issues. I mean, I'm 22, and I'm having sexual issues, indigestion, insomnia, anxiety, anger, extreme anger, hating life. And you know what? I went on and I went on and I went on and I went. I have a very high level of tolerating pain, extremely, I would say, to a point where I got used to it. If I didn't have pain, it was normal for me. I went on and on and on and on to a point where I was hospitalized 4 times. And 4 times, I live in Canada, so our amazing system, you walk in, they look at you, oh no, you have nothing, absolutely nothing. Go ahead, you're good. But doctor, I'm in pain, I'm dying of pain. And so on until this amazing doctor comes on and he's like God in the hospital. I was like, oh, I know what's wrong with you. I'm gonna remove your gallbladder. I'm like, I'm not a doctor, but you know what? If you remove my gallbladder, I think that will make things worse. No. I'm like, what about my digestion? He says, it has nothing to do with your digestion. That's what he told me. Okay, let's do it. I did it at the age of 28. 28, and a day after my surgery, things went way worse. I mean, my pain doubled. My symptoms doubled. I couldn't digest anything. Again, I went on and on and on and on. I'm a hard guy, I'm a tough guy, but I was getting angrier at life. Hated life. I'm not kidding with you guys. My story is very long, and I'm doing it
Tell
very
the part.
short.
So he told me, he was the one that told me to watch Root Cause. He's like, Dad,
Yes.
I was that guy. I did everything.
I did everything.
Everything.
So-
Went to every doctor. He went just fruit diet. I mean, it's almost humorous because he did every diet, everything. I mean, every procedure, anything, he did. Money didn't matter. He was going to get fixed.
Absolutely not. So, I'm going to go quick now. I got married a year later. This is when I hit my wall. I mean, my big wall. And it started with something called H. pylori. Now my whole gut, this whole area was super inflamed. Went to the doctor, guess what they gave me? Antibiotic. 1 didn't work, 2 didn't work, 3 didn't work, 7 didn't work. And guess what I have now? Super crazy inflammation. I couldn't eat anything. I couldn't sleep. The burning that I had in this region was crucial. Anxiety, earringing. My skin would just open up. Literally. I'd pee on myself. Literally. And I'm married with my wife. No sex life whatsoever. I mean, I'm reliving these moments, you know? So then, I started looking into the natural side, the holistic side, and I found this guy by the name, this is the only guy I will mention his name, he's in England, we don't care about him. David Humpis. So David Humpis says, yes, it's H. pylori, I'm a specialist, so on and so on, blah, blah, blah. I start working with him, things don't go that well. But he says you have now fungus, parasite.
Which he had all that.
Yeah. H. pylori, we're going to treat it. Started going on. And next to the second one, I went to Arizona. I went to New York. I went to, I forgot how many, Florida, Texas. Virtually, I'd say about 21 different doctors. And I don't want to go through all the details,
yeah,
but I did
for the
it
sake
all.
of time, get to what
Yes. So, a year ago, I finally fall on Danny, and then I tell my story. I'm like, hey, I've been fruitarian, vegan, vegetarian. I did everything possible you can imagine, and I still look like this. So, which he didn't see me. So Danny's approach was, and I was vegan. I was like, yes, vegan. So Dan comes on. He's like, hey, we're just gonna do little changes. He says you're gonna eat 3 times a day, no snacks, and you're gonna cut a little bit of your carbs.
Chapter 2 of the book.
For 1 month straight, every single day. I'm going to be very graphic now. Too bad I can't show the pictures. Worms. I mean, I inform myself. I had a 2.5 long worms coming out of me, and hundreds more.
So
in one day, I got 40 out. I counted them. I play with them. I actually talk to them. I promise you, I talk to them.
You did.
I do. I have
started
videos.
the detox, right? Because he was loaded with heavy metals, right? So which allows all these pathogens. So when we started getting rid of the heavy metals, out comes the pathogens. I made that point yesterday. So now we start doing that, but there's certain things that got better, no doubt. I mean,
yes.
He was like, hey man, my gut's so much better. We're dealing.
Yes.
I'm like, but there were certain things like the pain that absolutely were not budging.
No,
so
they weren't budging. Finally,
we got the cone beat. Massive infection. He went to Jerry. Jerry could.
I love you, Jerry. I love you, Jerry.
So
you changed my life, man.
He goes in and he literally on the way out said, Dan, is it possible that my pain, could be gone just like that? This is like I'm leaving his office and I have no pain. 21 years.
So he did the right side, and I had a 21 years pain right here in the liver. And even Dan, anybody did, it wouldn't go away. It's like I'm not going.
That's how I knew.
Not even an hour after, completely gone, 100% gone. But now I had some other pains. My prostate wouldn't budge. My prostate pain was a volcano with the hottest pepper in the world, right there, 24/7.
So he goes, gets the other one.
Now I go get the left side, and I had a bit of muscle issues on the left side. Completely gone, 100% gone. I did that 3 weeks ago. 3 weeks ago, I did my left side. My prostate, 85% of the pain was gone like this within an hour. And right after that, I had a huge purge of fungus. I know what a fungus looks like in the stool. I had a clump like this much. And that fungus wouldn't budge.
They're going to throw us off stage.
Yes.
The bottom line is...
I told you they would.
Yeah. The bottom line is this. Look, he could have dealt with the fungus and the parasites till the cows come home. That was me too. Until you get upstream to these causes, good luck. Good luck. You'll beat them back. They'll come back. That was his life. That was my story. That was his story. That was their story. The fact is you have to get upstream to the cause, and then the detox afterwards has to be at the cellular. You have to get the stuff out of the brain. You have to get it out of the deep tissues. You put it all together, all the fasting stuff, the multi-therapeutic approach. You've done it all. How many fasts?
I did. Oh, yes,
Many.
me too. Many. And I love them. I actually love the fast.
Yeah, he does now. That's for
I
sure.
do.
Well, look at him. He's a different person. Well, thank you. And I hold on. I have a gift for you. I told him because we were over time. I have a gift for you real fast here. So,
Well, because I think there's a quick thing to say. Don't just go to anyone to do this.
that's
I'm
the
talking about
point.
charity.
Yeah, exactly. We got over time and I forgot the most important thing. So go ahead.
This is our way to help out, right? Don't just find any other dentist. This is Dr. Caitlin and some of the other fantastic women in wellness. We're creating something called the Dental Detox.
With
But-
Dr. Pompa.
Right. But go to dentaldetoxchecklist.com. This is something that they worked hard on getting ready for this week so that you or the people you work with can ask the right questions.
To find the right dentist so that if you do have amalgams or cavitations, that they're done properly. Because we've seen it too many times where it gets misdiagnosed or not addressed, and it absolutely needs to be done correctly. So that's our gift to you. I hope you guys utilize it, because the mouth, you gotta look at it, guys, if you're gonna truly help people.
Well, multi-therapeutic approach. Think of the stool. It's everything. So, free thing for you. Help save lives.
Well,
Don't let people be-
in this, we have the pre-protocol that we do ahead of time. We have what we do during, on our end, not the dentist end. Jerry's going to get more to that. And then, obviously, what we do after is very critical. So, there you go. And so, by the way, this came out of their pain, right? So that they're so passionate about this that they're filling a void, being platinum elites, that we needed filled to make it easier. So, thank you guys. Awesome.